Oklahoma, welcome back. It is that time of year again, flu season, and if you get sick, you might have to miss work or school. You don't want that. So this morning, we're talking more about respiratory virus season, joined by Mike Mennell, the Assistant Director for the OSDH Infectious Disease Prevention and Response. Mike, it's nice to have you.
Oh, thank you for having me.
So it is that time of year. You know, the sicknesses can go around. Tell us just kind of what you guys are seeing and as we get into flu season, what people should know about.
Yeah, absolutely. So we are entering that time of the year. We consider respiratory season to be the early months of fall all the way into kind of the beginning of spring is typically how long a standard season will last, although there are a lot of variables that can make it last shorter, longer, have different peaks at certain amount of times, but it is certainly the time of the year where we're expecting to see some of those respiratory illnesses like influenza and RSV beginning to climb.
Yeah, and this new normal that we have too with COVID, right? That another curveball that gets thrown into the mix. I know we had a recent spike kind of a little bit ago now, but are cases coming down when it comes to COVID?
Yeah, so thankfully we're starting to see our COVID-19 cases decreasing across the state, which is great news, and we're seeing our influenza and RSV number of infections kind of plateaued, but we do expect those to continue to rise as we enter the fall months.
So let's talk prevention, right? How can people get themselves protected, make sure they can stay healthy this time of year when flu starts getting crazy?
Yeah, so the best thing that you can really do, thankfully for a lot of these respiratory illnesses, hand hygiene is going to be your best friend. A lot of people are going to be going out. I know people get busy during the holidays and travel, so really being rigorous about hand washing. The ideal method of that is to wash your hands with soap and water. Now, if you are on the go and don't have access to soap and water, hand sanitizer is a great alternative.
Would you recommend getting the flu vaccine, right?
Yeah, it's always recommended to talk to your healthcare provider about that, especially certain individuals that may be at higher risk for a more severe infection. Talking to your healthcare provider to see what kind of preventative methods you can take during this holiday season, and influenza season and RSV season is always going to be a great next step.
Yeah, hopefully you can avoid getting it in the first place. But if someone does come down with the flu this time of year, what are some of the best ways to treat it? I always hear about like vitamin C packets. I always drink vitamin C. Is that a good way? Or what should people be doing? Tips and tricks to beat the flu if you catch it.
Yeah, so making sure that you're keeping your immune system healthy is a great way to help protect yourself if you are exposed to some of these viruses when you're out and about. So, when you do have an actual respiratory infection, thankfully, most of the time it's going to be pretty mild. You can manage it, at home with over-the-counter medications such as fever-reducing medications, cough medicine, sore throat sprays, things like that. Getting plenty of rest, making sure that you're staying hydrated. Those are all going to be great tips that you can follow. Now, if you do have a more severe infection, it's always best practice to talk to your healthcare provider to see if there may be any treatment that may be necessary for you, or you may need some more extensive medical care.
Yeah, if it gets bad, go to the doctor.
Yes.
And you guys have some great resources, right? People can access the data to see exactly how many cases are, how bad it's getting, or how can people do that?
Yeah, absolutely. So at the Oklahoma State Department of Health, on our website, we manage something that's really fantastic called Oklahoma Viral View, or OK Viral View as we call it sometimes. Yeah. It's really going to be your best one-stop shop throughout the flu and RSV and COVID-19 season to see what's going on across the state and across your communities. During respiratory season, we actually update our website each week. So we really do consider it to be a great one-stop shop, not only for members of the community, but also for healthcare providers, just to see what's going around.
Yeah, maybe like a curiosity question. What makes this time of year flu season? I mean, viruses spread easier when it's cold, right? But what other reasons is this the time when flu spikes?
Yeah, that's a great question. So typically, not only are these viruses going to begin circulating, but it also coincides with colder weather, so more people are spending time indoors.
Yep.
More people are gathering with friends and family for holidays. They may be traveling across the state, across the country, sometimes across the world. So you're really creating a lot of opportunities to kind of be gathered indoors with individuals and being exposed to some of these viruses.
A melting pot, yeah. And
yes.
We'll make sure we get some of this valuable information on the As Seen On section of KOCO.com as well, places where people can access the data and see exactly how many cases there are, right? On
yes.
your guys' website. That's awesome stuff. Well, Mike, thanks so much for coming in. We appreciate it.